kind of tapping into that social worker in you, as an expert in end-of-life issues and hospice, what are your thoughts about planning, like for funeral planning? How does that fit in, or does it fit in?
Oh, it absolutely fits in. And that's where I come into play right from the start. Is not only do I describe and educate the families on the hospice program and all of our disciplines involved, there are consents that they have to fill out and agree to the program. Now, just to let everyone know, hospice is free, provided by Medicare benefit. Okay? Room and board is not free. But if the family doesn't have everything in place, that's where our social worker and chaplain will come in to help them get to the next level and educate them on what's available. Saying that up front, part of the consent is, what funeral home do you have chosen? And are plans already made? And if the plans aren't already made, the chaplain and the social worker will take over at that point to make sure that the needs are met exactly for what the patient is asking. As we know, at the end, sometimes the family can change the plans, but it's important to have the funeral home and if they made the services up front, and that's part of our consents. So that's the role we play. Being in the hospice industry for, like, as I mentioned, 18 years, we do know a variety of funeral homes to recommend. Cremation. A lot of people are going for cremation.
Yes.
They do ask me up front, do I know pricing a little bit? Or what's the difference between if they have cremation and a viewing or things like that? I don't quote people. I just say probably this is, more on the higher end, the full-blown traditional funeral, but most people are choosing cremation at this point. And just going over a little bit of what that entails that I know of from working with Bradley Funeral Home and being educated at that point in the conversation. But it's imperative that we know that, because if the person comes on to service, they just signed the consents, they're at home or are discharging from a hospital or whatever, they can very well die within a few hours. And if we don't have that down, it's a whole different ballgame.
Yeah.
So it's very important.
Can you describe for me the whole different ballgame? You've seen both. You've seen a well-prepared family and the outcome, and a family that has not done the preparation. What's the whole ball of wax there?
Well, it's pretty complicated and it's very costly, because if they're in a facility, they can't move. They can't do anything until whomever's in charge, and that's the key. Whoever is the power of attorney on paper, not whoever thinks they're the power of attorney or is like the oldest family member and they're leading the charge, or if they're the spouse and leading the charge. If they're not listed as a power of attorney, they have no right to make that decision. Right. So everyone's standing around waiting, and now you're getting charged to be in the facility or to be in the hospital, and you're put on hold, if you will. And that's running. That time is running, and your loved one is just lying there, really, with no way to go. And the families are sometimes not cooperative, and they're difficult. The dynamics are difficult back and forth, and we're trying to help them out the best we can and communicate with them. And it's just usually a debacle, if you will. It's a mess. But someone who is ready, they've done their homework, they've listened to us, because prior they didn't have anything in place. It's just such an easy transition for the whole family.
Yeah. My 30 plus years, almost 40 years now, I can almost tell. I don't make too many funeral arrangements anymore, but when I did, a family that was on hospice and well prepared came to funeral arrangements with such a calmer demeanor, a sense of I don't know, that they're a little bit at peace, that they had done the hard work, and that now they could celebrate this person's life or put them to rest or whatever you'd like to say. But the families that didn't do it, and we see this a lot in nursing home care, not as much hospice care, but that the families are not prepared at all. And it is chaos. Especially we have families that might have siblings that are at a distance, that don't get along. And now we have a lot of discord between family members, and that could have been worked out ahead of time. And it has a dramatic effect on how the funeral arrangements go and how those funeral services go.
Yeah, and it has a direct effect on the family members as well. And, the social worker tries to intervene, but with the social worker and the chaplain being there and everyone in place, it's just such an easy transition for us. And working together, with the Bradley Funeral Home and the Hospice of New Jersey team, it's effortless. And you couldn't ask for anything more peaceful to honor the family and the patient that just has passed.
Thank you. I'm going to tap a little bit into my psychoanalytic training. And one of the things, we've had this discussion in the past, and this idea of when is it appropriate for a family to plan? Because if there's only a couple hours, I don't know if it's a good time to plan. It's too late.
Yeah.
And they should spend their last hours with the person who's dying. But how soon do you think is an appropriate time?
Well, here's the thing. Anyone over 18 should have everything in place, because there's so many misconceptions, first of all. But if someone's coming to us and they're young and it's an unexpected illness or, God forbid, a car accident or something like that, the parents don't know that they cannot make a decision for this 18-year-old without having a power of attorney in place. But yet, it's such a dramatic thing that happened. Now they have to scramble and think about a funeral home at that point.
Yeah.
I mean, it's incomprehensible. But when you're 18, you really need to have that discussion as a family, possibly, and get that all in order. And it may sound, well, that's too young. You're never too young. It can happen anytime.
That'll be the first sign that they are grown-ups.
Yes, correct. And there's 5 wishes that we can give out if anyone needs, and I'm sure you have some education. But it's a good thing. I think they should be taught that, in education somewhere along the line, because it's very important. It
just occurred to me, when I was much younger and had a baby and, building up the funeral home business, I had to get insurance to cover my liability. So I didn't, if something happened to me, my life would have been a burden on my wife and children, whatever. Well, why not make your funeral arrangements then?
Exactly.
You have a will, you have life insurance, whatever it might be.
And the cost, it's already taken care of. And I'm sure it's a lot different now than, 60, 70 years from when you're 20 years old or whatever,
Yeah.
So it's a good idea to think about it and have a family discussion about it.
Yeah. So Marilynn, I've had the pleasure of working with you for years. I was wondering what your thoughts were on funeral service and hospice collaborating on educating consumers to improve end-of-life experiences. How can we work together?
That's great. And I think we work together well because we've been doing that, but getting it out a little bit more with the hospital team, the social worker team. But I think getting into the community is the way to go with all of the services related to healthcare, because it has changed so much, especially in the last 3 or 4 years, as we've seen. And people don't realize exactly what the need is. And unless you had a loved one come on to hospice, you don't even know about all of these dynamics and how you should have everything into play. And especially end of life. So I think go into the community, and if you have any groups that you think this would be valuable information to, I think that's a great way to do it.
Yep, I agree.
Yep.
So I'm going to say that those of you out there in fraternal groups, in community groups, educational groups, that you find your local hospices, especially Hospice of New Jersey or Bradley Funeral Homes, or us collaboratively would like to work together to speak to people in the community and teach them about hospice care, good health care, good end-of-life care, and planning for funerals. So, Marilynn, I'd like to thank you.
You're very
greatly
welcome.
appreciated.
My pleasure.
I am grateful for all your support and your friendship. Thank you very much.
Likewise. Thank you.